Good afternoon. My name is Irene and I would like to introduce the members of our group. Irene and Cindy will both start off by discussing the links between culture and Aboriginal and Torres Strait Islander health. Camilla and I will identify and explain the relevant Aboriginal and Torres Strait Islander social determinants of health that impact our selected issue, which is cardiovascular disease. And lastly, everyone will explain how we, as future registered nurses, will deliver culturally competent and safe care to Indigenous Australians with cardiovascular disease in remote areas and who are in need of access to Aboriginal community-controlled health services.
Australian Bureaus of Statistics use a remoteness structure to divide Australia into 5 different classes of remoteness. This map indicates a basic idea of what is a remote area. The Royal Flying Doctor Service defines all areas outside Australia's major cities as remote and rural. According to the ABS, in 2011, about 24.4% of Aboriginal and Torres Strait Islander people, hereinafter respectfully refers to the Indigenous Australian, lived in remote and very remote areas, while 1.7% of non-Indigenous Australians live in remote and very remote areas. Indigenous Australians who live in remote areas normally experience poorer health outcomes than those who live in major cities. One of the reasons is the disadvantage of living conditions and lack of access to healthcare services. They usually have to travel long distances to reach health service and receive health care. Many Indigenous Australian people are facing different health problems. Cardiovascular disease is recognized as one of the major diseases that requires ongoing medical care. And now we will be focusing on how Indigenous Australians' culture, social determinants influence their health in remote areas, as well as delivering culturally competent and safe care to Indigenous Australians, as it is an important concept in ensuring patient safety and achieving quality patient-centered care.
The Aboriginal and Torres Strait Islander community beliefs on health are based on a spiritual connection to their country or land. When referring to the term country, it is not just connection to the land but a multi-layered dynamic including the formation of land, air, water, and stories of dreaming. The dreaming is considered to be both the ancient time of creation and the present-day reality of dreaming. This is how they connect with their ancestors from the beginning of creation and learn about their culture and beliefs. Their understanding of country has been developed and passed on to their posterities, which ultimately shapes their view of health, connection to others, and their own personality. A disconnection to their country has been proven to affect their health, well-being, and life outcomes, as they may feel a loss of self or belonging. The historical factors, drawbacks, the current difficulties in Aboriginal health outcomes. In 1788, the non-Indigenous people arrived and they had negative impact to the Indigenous people well-being due to sharing experiences of colonization. The negative outcomes may include racism and discrimination, forced to take away the children, loss of self, language, culture, and land. Studies have also shown that Indigenous language also affect their health and well-being. This means that the growth of Australia's Indigenous language is to reinforce their identity and self-esteem, not just for communication. As they feel the effect of loss of self or belonging, they are more likely to participate in factors that affect their overall health, such as smoking. This ultimately increases the likelihood of having cardiovascular disease. Caring for country means connecting and interacting with the traditional land in order to promote ecological, spiritual, and human health. A study was conducted in Arnhem Land of almost 300 indigenous adults, and findings discovered that participating in the caring for country led to better diet, physical activity, mental well-being, and lower risk of cardiovascular disease. As healthcare services are able to understand the multi-layered understanding and importance of connection to country for the indigenous population, they are able to connect with the surroundings communities to provide culture competent care and awarenesses. Cardiovascular disease impacts on the Aboriginal and Torres Strait Islander population, as this ultimately reduces their lifespan, quality of life decreases, rise of hospitalization rates, and the prevalence will continue to increase if action is not taken. The indigenous population living within the remote areas are highly disadvantaged due to their location and also because they have limited control of the life. For example, less incomes, poorer levels of education and employment. Likewise, living in a remote area limits your access to facilities compared to those in urban areas, which means they have less health specialists, higher expenses of healthcare delivery, and diminished health infrastructure. It's important for those living in remote areas to have adequate access to health care services, as this is a source of health literacy for them to be able to educate themselves in order to reduce the likelihood of cardiovascular disease or to better manage it. Due to the remote areas being very vast and sparse, the amount of healthcare facilities is very limited and may be hard for the Aboriginal and Torres Strait Islander population to get to, as it may take a long period of time to reach.
Cardiovascular disease is significant for individuals or societies within the Aboriginal and Torres Strait Islander population, as this is the largest cause of death within this group. Currently, 21.4% of the Indigenous Australians live in remote areas, and 5% of those Indigenous adults had evidence of heart failure. The main reason of premature death within the Indigenous population was found to be cardiovascular disease. Aboriginal and Torres Strait Islander people are twice as likely to experience cardiovascular disease than those living in urban areas due to access to healthcare services, environmental factors, and inequalities of evidence-based practice. When comparing the health status of Indigenous health to non-Indigenous people in relation to cardiovascular disease, Aboriginal and Torres Strait Islander people were 70% more likely to die from the disease than those of non-Indigenous background, which only had 14% of deaths in 2015 from the disease. The Indigenous culture and the health services must work together in order for a desirable outcome. This is referred to as cultural competence. When addressing the cardiovascular disease, the health services must address the issue holistically, not just the issue itself. They must look at their culture, their background, other factors that may affect the disease such as lifestyle. And in remote areas, access is hard to achieve as the distance among facilities and all communities may be vast and therefore hard to get to. The limited facilities in remote areas affect all communities due to cost factors. The current healthcare policy relating to cardiovascular disease for the Aboriginal and Torres Strait Islander population is the Closing the Gap campaign. This government initiative aims to reduce the disadvantage among this population in respect to life expectancy, mortality, education, and employment. The campaign was developed in response to the Social Justice Report 2005 and initiated in 2008.
The ultimate aim is for both the government and the Indigenous population to collaboratively work together to achieve equality in the disadvantaged areas by 2030. By achieving this campaign, the prevalence of cardiovascular disease would be reduced, as the younger populations would be obtaining the health literacy through school. Employment rates will be higher, so therefore are able to purchase nutritious food for a balanced diet. One of the aims within this campaign is to ensure all Indigenous 4-year-olds in remote communities to have access to early childhood education within 5 years. Another aim is to find more evidence-based information to learn more about their culture in relation to health. Due to the Aboriginal and Torres Strait Islander population having a history of high blood pressure and diabetes, they are major contributors to cardiovascular disease. By managing those health issues, a longer life expectancy and better quality of life is achievable.
According to the World Health Organization, social determinants of health are the conditions in which people are born, grow, live, work, and age. It plays an important role in people's health. How these social determinants, such as education, socio-economic status, health, and their own health behaviors, affecting Indigenous Australians' health will be discussed. It is often said that housing is the fundamental of health. However, the lack of adequate housing causes lots of Indigenous Australians living in remote and very remote areas with poor housing standards. The living conditions in the remote areas are usually poverty and overcrowded. It was a frequently reported health issue in the communities. Poor standards of housing contributes a lot to Indigenous Australian people's health problems. Indigenous Australians are more likely to have untreated bacterial infection because of housing problems. For example, the group A streptococci infection that is normally found in the throat and skin caused by untreated bacteria can damage heart valves permanently. Inadequate housing influences Indigenous Australians' health in a negative way. Another factor to consider is Indigenous Australians' health behavior. Due to the poverty and difficult access to fresh food, Indigenous Australians who live in remote areas are normally unable to maintain a healthy and well-balanced diet, as well as the habits of smoking among Indigenous Australians. Tobacco consumption increases the risk of obtaining cardiovascular disease. As per research, 48% of Indigenous Australians are regular smokers, while 15.1% of non-Indigenous Australians smoke. The rates of daily smoking are also high in the outer Aboriginal and remote areas of Australia, which is 20.9%, compared with inner regional areas 16.7% and major cities 13%. Last in sequence, the lack of physical exercising of Indigenous Australians is also the reason for them to increase risk of being cardiovascular unhealthy. Those unpleasant health behaviors admittedly contribute to the prevalence of Indigenous Australians reporting cardiovascular disease.
Aboriginal Community-Controlled Health Services is a primary healthcare service operated by local Aboriginal communities to deliver holistic, comprehensive, and culturally appropriate healthcare to the community which controls it. This will be discussed throughout the presentation about why this is significant for individuals and the surrounding communities. The equity of access to healthcare is an issue for Indigenous Australians living in remote areas, as this can negatively influence their health. Unemployment and geographic locations are contributing factors that can have a negative impact on their health and can lead to cardiovascular disease. Indigenous Australians who are unemployed are less likely to be in excellent health than those who are employed. Labour force participation, such as remote mining regions, is the lowest in remote and very remote areas. According to the Australian Bureau of Statistics, in 2011, 61.3% were employed in major cities, whilst on the other hand, 36.1% are unemployed in very remote areas. With increasing remoteness, people would have to travel long distances in order to access health services, and those who are unemployed would not be able to receive any treatment or assistance they need for their health and well-being. All these social factors interact and contribute to poor health. There is a vital need in funding health services so they are affordable for Indigenous people who might otherwise not be able to afford them or not have access to them. An example is the Remote Area Health Corps, which is a government-funded agency that recruits urban-based health professionals for work in remote Indigenous communities in the Northern Territory. They provide training and ongoing support to assist health professionals to make the transition to remote practice. This would assist them in having more accessible health services, especially in remote areas. Socioeconomic disadvantage remains a key influence on educational opportunity in Australia. Education is the foundation for employment and generating an income. It enables individuals to engage with information about health and to take the appropriate actions to maintain their health. This engagement is referred to as health literacy. When a person does not have a basic level of education, they are more likely to be health illiterate. A good level of education determines one's health literacy, employment, and social status and productivity. Lack of education affects the health and wellness of lower socioeconomic groups, with many of those groups living in remote areas. According to COF, 36% of Indigenous Australians living in remote communities have access to a library. This enables community members nearby to access reading resources and learn about health-related material and take appropriate actions to prevent and manage illness or disease and maintain their health. Since Indigenous Australians have higher risks of being diagnosed with cardiovascular disease, it is essential that they know about the disease and how other people can prevent and manage it. While remote education providers find it difficult to attract and retain qualified staff, there is evidence that recruiting staff who already lives in these communities is effective, as it provides opportunities during training to spend time in remote areas. The Council of Australian Governments has committed to halve the gap in reading, writing, and numeracy achievement by 2018, and with increased educational attainment, better opportunities for employment should arise.
Cultural competence refers to the ability to interact effectively with people across different cultures. It composes of 4 different components: awareness of one's own culture, which shapes our own assumptions; positive attitude towards cultural differences; knowledge of different cultural practices and worldviews; and cross-cultural communication skills. By acknowledging these components, nurses will allow themselves in delivering effective care, which is culturally competent. It's important for the nurse to understand the multi-layered and complex culture so the level of care delivered is able to connect and be accepted with the individual or group. Nurses who do not deliver cultural competence within their nursing care are not able to connect with the Aboriginal and Torres Strait Islander community properly. This would lead to patient dissatisfaction, level of communication to be lower, quality of care is also lower, and the community is least likely to be using or returning to the health facility in the future. The cause of a nurse not delivering culturally competent care can be due to a lack of knowledge or understanding of the culture, previous bad experience, or lack of training/experience. It's important for the nurse to be delivering safe care, as the number of resources or facilities in remote areas is limited, and if it's not effective, cardiovascular disease prevalence could increase. Health promotion is one of the strategies used in order to reduce health prevalence, such as cardiovascular disease. Health promotion can be performed through several ways in remote areas, such as collaborating health service providers and the community, actively promoting the issue of cardiovascular disease, hiring Indigenous people to work within the health team, and educating schools regarding to the issue. Through health promotion of cardiovascular diseases, nurses will be able to spread information and prevention or intervention strategies. For example, choosing a healthier diet or quitting smoking. Health literacy within the schooling system was proven to be effective in the No School, No Pool campaign, which is also an example of early intervention. In the Barangara community, ear problems reduced from 90% to 54%, and skin sores reduced from 28% to 3%. This also increased school participation and overall well-being. When early interventions are used, the overall cost factor in the future is reduced as treatments more costly. Early interventions for cardiovascular disease includes a healthier diet, reducing or quitting smoking, and maintaining daily adequate exercise. The use of screening-based buses can be used to travel to other communities, so nurses are able to identify those of risk of cardiovascular disease by evaluating their body weight, blood glucose levels, smoking, physical activity, diet, and fasting lipoprotein profile. As a registered nurse, I will demonstrate culturally competent and safe care by following alongside the Nursing and Midwifery Board of Australia documents and guidelines. Within the Code of Conduct, Statement 9 refers to maintaining and building on the community's trust and confidence within the nursing profession. This is important within the remote community as trust is the biggest issue between the Indigenous population and non-Indigenous people due to the Australian history. Trust must be earned in order to help the remote Indigenous communities to reduce the rates of cardiovascular disease. Without gaining trust, the issue will continue to be the main cause of death within the Indigenous Australians. Within the Code of Ethics, it states that nurses advocate for equity and social justice in resource allocation, access to healthcare and other social and economic services. By increasing the amount of health services, they will become more accessible as distance becomes less of an issue and used more frequently, therefore addressing the cardiovascular disease health issues. By placing the Nursing Midwifery Board of Australia documents and guidelines at the centre of practice, I will be able to demonstrate cultural competence and safe care to the Aboriginal and Torres Strait Islander population in remote areas.
The lower health standard of Indigenous Australians compared to non-Indigenous Australians is not uncommon, especially in remote areas. Indigenous Australians' poor health results from many factors, including their connection to their land and their country. Respecting Indigenous Australians and their culture is essential in reducing disadvantages among them. The social determinants of health identifies the gap between health status within the Indigenous population. It is evident that the social determinants discussed in this presentation all negatively affect Indigenous Australians living in remote areas. It is vital that access to health services, learning materials, and job opportunities must be a priority to assist prevention and management of cardiovascular disease. By understanding nursing responsibilities, performing efficient health promotion, and demonstrating professional proficiency as a registered nurse, we are respecting Indigenous Australians and showing awareness. Therefore, we are able to deliver person-centered care and ensure patient safety, as well as closing the gap